Charter Local Edition. I'm Brad Pomerance in the San Gabriel Valley, joined by Ed Hernandez, member of the California State Senate. He's announced his intention to run for lieutenant governor in 2018. Chair of Senate Health still.
Yes, still chair of
And
health.
so there's a lot of concern about the future of the Affordable Care Act, the Obamacare. What we know is that California has seen its uninsured rate drop by 50% since the Affordable Care Act passed. 1.4 million get their insurance from Covered California. The Medicaid expansion, what is it,
Right.
3 million? A lot of people are getting their insurance because of the Affordable Care Act.
Right.
And so where do we go from here? The president has said, President Trump, he's not interested in continuing the Affordable Care Act.
So California embraced it. We have been successful. We've reduced our insurance rates, and we have also decreased the number of individuals that are uninsured. It is working in California. I guess the question I would pose not only to this new administration, but the Republican Congress as well, is you're talking about repealing and replacing. What are you going to replace it with? They have no clue.
Well, what they have indicated, and I say in the background that, remember, with the Medicaid expansion, the federal government pays 90 to 100%. With Covered California, 90% receive federal subsidies. And so when we consider that, if they do repeal and replace, there have been discussions about block grants. And so, you know, maybe that's good. Greater state control.
No, I don't think so.
No.
And here's the reason why. I mean, we have amongst the lowest reimbursement rates for Medi-Cal as it is. If they were to block grant us, we may be doing okay for a while, but it doesn't build in inflation in the future, especially if you have increasing drug prices, as
Which we're going to
provider
talk
rates
about.
go up. I mean, we can't. I mean, we will be in a real hurt if they block grant us.
So where does California go from here? Because look, there have been issues with the Affordable Care Act. Premium spikes have been more than had been desired. The pool has been a little older and less healthy. And so there have been challenges, but the opponents refused to talk during the Obama years. Now they're emboldened during the Trump years. And where do you, as an advocate of the current system, maybe looking for some tweaks, where do you go?
Well, as an advocate for the current system, what's most important is the subsidies. You have to have federal subsidies to allow the individuals that can't afford it to be able to get health insurance. The second thing is you have to have the individual mandate. If you do not have the individual mandate, you're not going to have a large enough and healthy enough pool. And it's working in California. Our rates are amongst the lowest in the country. We've got to be able to keep them.
But the president, I mean, this new administration has been clear. They're not interested in the individual mandate. They're not interested in the Medicaid expansion. They are interested, interestingly, in keeping the pre-existing condition exclusion, allowing children, adults up to the age of 26 to maintain their parents' health coverage. But how would they do that without the mandate? Because in order to allow that, you need a bigger pool.
So here's what's going to happen. They're picking and choosing the most popular amongst the consumers. I guarantee that if you do not have the individual mandate, you will have skyrocketing healthcare premiums that you will never see, that you've ever seen before in this country. The reason why is because if you're not going to mandate that the entire population have health insurance, people are going to say, oh, I don't want it. I'm not going to buy it. And then they're going to get it when they're sick, and you're going to have a sicker population that are insured, and rates are going to go up.
What's so interesting to me is a poll was taken in the wake of the Trump victory, and while the Affordable Care Act was marginally popular versus unpopular during the Obama years, all of a sudden it's more popular now. All of a sudden. You have about 50% wanting the Affordable Care Act to be expanded or implemented as is. You have under around 40% who are looking for some scaling back, but that's flip of what it used to be.
And the reason why is the consumer is now seeing what they have. They can get insurance without a pre-existing condition. They have maximum out-of-pocket expenses. People don't go into bankruptcies. You have the 10 essential health benefit. It is a good health product. However, may not be perfect. Let's make it better, but let's not get rid of it.
I just don't know how the new administration can backtrack on this promise. Mr. Trump could not have been clearer.
No,
he wanted to repeal Obamacare. In that same poll, 81% of his voters had an unfavorable view of the Affordable Care Act. We got to prepare, sir.
Yes, I get it. I understand. But here's not only the president-elect, but I think the Republicans who've been beating up on this for decades. It's sort of like the dog that's been chasing the car, who finally caught the car, and now they're saying, well, what do I do with it? Okay, well, you have been beating up on it. Now come up with a solution. But come up with a solution that's going to guarantee that the consumer is not going to get skyrocketing rates. It's not going to happen, and its rates are going to go up.
Are you able, as chair of Senate Health, to talk to, for example, Kevin McCarthy, congressman from Bakersfield, senior Republican in the House? You come with stature. Can you try to influence the debate if that's what you so choose to do?
Well, obviously, my number one priority is to make sure that we maintain some semblance of a decent health plan, not only in California, but this country. So I will advocate to everybody and anybody if I have to go to DC, if I have to speak to the ranking congressional members, and articulate the argument, and hopefully let them hear me out.
I want to speak with you about drug prices. We know that increasing drug prices have been in the news, be it Martin Shkreli, be it through the EpiPen. You had a bill that really seemed to be moving really nicely in the last session that would require drug companies to notify state health programs and private insurers before there was an increase. Then it got junked up with amendments in your mind. You pulled the bill. You're looking to bring it back in this upcoming session. What do you think? The lobbyists really got a hold of that, of SB 1010. What about your new SB 17?
So it's pretty much the same bill. We're going to refine it a little bit more, but it's broken down into two parts. Obviously, the notification or the transparency portion and the notification. But yes, prescription drug prices are the reason why we have an escalating healthcare prices in our country. And we need to do something with it. There's very little the state can do, but that's why we introduced this transparency bill. But I will tell you, the pharmaceutical industry is probably the most powerful lobby in the state and the country. They've hired tons of lobbyists to lobby against this bill, and they'll continue to do the same thing.
In the past year, 16 states were considering measures like yours. A grand total of 1 got that bill out, and that was Vermont.
And what does that tell you? It tells you that the consumer across the country is fed up with these rising prescription drug costs. Something needs to be done.
So the amendments were looking to increase the floor where notification would need to be made to 25%. You were looking at a 10%. Is there a compromise there?
You know, I mean, that was just way too much, plus the way it was gutted in the appropriations. There would have been a sunset provision, and the sunset provision would have made it worthwhile, but we're going to bring it back. The most important thing is the consumer or the purchaser of the product, which is the health plans, the state of California, the prisons, CalPERS, need to know ahead of time what's going to happen when those drug prices go up.
Are you asking for justification for the increase? Because that was also a sticking point last year.
No,
you simply want notification.
Notification. But more importantly, we also want to know some kind of trigger as those drugs go up in price a certain percentage. You need to notify the consumer or the purchaser.
Right.
It's very, very important.
And so what happens? Notification, is there anything that can be done? Can the insurance commissioner jump in, or it's just a notification?
No, and unfortunately, because the states don't have a lot of power, the federal government really needs to be taking care of this in the form of patenting laws.
Right.
I don't believe in price fixing or setting prices,
Right.
but by notifying, let's say, the purchasers midterm of whenever there's the contracts, they can say, okay, well, here what we can do is we can renegotiate and maybe postpone.
His name is Ed Hernandez, member of the California State Senate, candidate for Lieutenant Governor in 2018. I'm Brett Pomerance.